Welcome back to my channel. Today we'll see about another high-yield NEET PG orthoca question, Fat Embolism Syndrome. It has been asked 3 times in NEET PG in the last 5 years, and every time the clue is almost the same. So if you just find these three clues in your question, you can easily solve this question in just within 10 seconds. I'll show you exactly what the clues are and how the Gurd's criteria is asked and how not to confuse it with pulmonary embolism. So let's get back into the video. Fat embolism syndrome is usually seen after long bone fractures, especially the fracture shaft of the femur. It can also occur in other bones like pelvic fractures, multiple fractures, or orthopedic procedures like intramedullary nailing. Let's have a sneak peek about its pathophysiology. So, the fracture ke baad, fat droplet starts entering the circulation. So, this is how it starts getting lodged in many organs. Now, these fat droplets from the circulation lodge in the lungs, and this causes respiratory distress that may be tachypnea, breathless. Along with the lung, these droplets also lodge in the brain, and this causes CNS symptoms like confusion, delirium, etc. And it also causes petechial rash, mainly in the upper chest region, axilla region, and conjunctival region. And the classic triad you see in the fat embolism syndrome is this thing. So, whenever you see any of these things in the question, you have to simply go for fat embolism syndrome. CNS, confusion, and delirium, and respiratory distress, you have tachypnea, breathlessness, and agitation. Sorry, hypoxia, all these things, and petechial rash, mainly in the upper chest, axilla, and conjunctival region. This is the Gurd's criteria. This is used for diagnosing fat embolism syndrome. So, the major criteria are three: respiratory insufficiency, and you have cerebral spine signs, confusion, drowsiness, all these things, and petechial rash over axilla, conjunctiva, and upper chest. These are the three major criteria, and you have minor criteria. Those are tachycardia, fever, retinal changes, jaundice, renal changes, anemia, thrombocytopenia, elevated ESR, and fat macroglobulinemia. So, to diagnose it as fat embolism syndrome, you should have at least two major criteria or one major criteria plus four minor criteria. So, if you have this, you can diagnose it as fat embolism syndrome. You can remember the mnemonic here if you want. So, this is how you diagnose fat embolism syndrome. If you just have this one sheet with you, you can get your question right. And this is a differentiation trap. The pulmonary embolism and fat embolism syndrome, what is the difference? So, pulmonary embolism is usually sudden, and it has risk factors for DVT, and you have sudden dyspnea, chest pain, and hemoptysis. Whereas fat embolism syndrome is delayed, it is usually occurring 24 to 48 hours after, and that is precipitating factor is long bone fracture. Symptoms are respiratory distress, tachypnea, and confusion, all these things. So whenever you see these kind of symptoms followed by long bone cuff fracture, definitely you have to go for fat embolism syndrome. Now let's see few MCQs of PYQ styles, like which are asked in the NEET PG, that style. So let's see if you can answer this or not. So, a man is brought to the emergency department following a road traffic accident, and he is diagnosed with mid shaft fracture of the femur. He undergoes surgical fixation. 2 days after surgery, he develops breathlessness, tachycardia, confusion, and petechial rash over the chest and conjunctival hemorrhages. So, the most likely diagnosis is C. He had undergone the mid shaft fracture of the femur, and you have breathlessness, tachycardia, respiratory distress, and confusion, petechial rash. You have three major criteria here, so it's obviously fat embolism syndrome. Next question. Yeah, shaft of femur fracture, road traffic accident. 12 hours later, he suddenly develops breathlessness, confusion, and petechial rashes over the chest and axillary region. Obviously, you have petechial rashes, breathlessness, confusion, definitely, and femur fracture, definitely fat embolism syndrome. And you have another question that shows he complains of dyspnea, petechial rashes, and significant drop in oxygen saturation. Yes, this is also a fat embolism syndrome. And here comes another question. Let's see if you guys could answer this wrong. Let's see. I hope you guys got the clue to solve this question. So if you get this question in NEET PG, you can solve it in just 10 seconds. So I hope you like the video. If you find this video helpful, please like, share, and subscribe. Share it to your friends who are preparing for NEET.